Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 1. The Baby-Friendly Hospital Initiative, a part of the global strategy. On completion of this session, participants will be able to state the aim of the WHO UNICEF Global Strategy for Infant and Young Child Feeding, outline the aims of the Baby-Friendly Hospital Initiative, describe why Baby-Friendly Hospital Initiative is important in areas of high prevalence, explain how this course can assist this facility at this time, review how this course fits with other activities. The Global Strategy for Infant and Young Child Feeding. About 5,500 children die every day because of poor infant feeding practices. In addition, many children suffer long-term effects from poor infant feeding practices, including impaired development, malnutrition, and increase in infectious and chronic illness. Rising rates of obesity in children are also linked with lack of breastfeeding. Improved infant and young child feeding is relevant in all parts of the world. The World Health Assembly and UNICEF endorsed the Global Strategy on Infant and Young Child Feeding in 2002. The aim of the global strategy is to improve, through optimal feeding, the nutritional status, growth and development, health, and thus the survival of infants and young children. It supports exclusive breastfeeding for 6 months, followed by timely, adequate, safe, and appropriate complementary feeding while continuing breastfeeding for 2 years and beyond. It also supports maternal nutrition and social and community report. The global strategy does not replace, but rather builds upon existing programs, including the Baby-Friendly Hospital Initiative. The Baby-Friendly Hospital Initiative is a global initiative of the World Health Organization and UNICEF that aims to give every baby the best start in life by creating a healthcare environment that supports breastfeeding as the norm. The initiative includes a global assessment and accreditation scheme that recognizes the achievements of health facilities whose practices support breastfeeding and encourages health facilities with less than optimal practices to improve. The aim of the Baby-Friendly Hospital Initiative is to implement the 10 steps to successful breastfeeding and to end the distribution of free and low-cost supplies of breast milk substitutes to health facilities. The Baby-Friendly Hospital Initiative provides a framework for enabling mothers to acquire the skills they need to breastfeed exclusively for 6 months and continue breastfeeding with the addition of complementary foods for 2 years or beyond. A baby-friendly hospital also assists mothers who are not breastfeeding to make informed decisions and to care for their babies as well as possible. The global strategy calls for further implementation of Baby-Friendly Hospital Initiative for breastfeeding in the curriculum of health workers training and for better data on breastfeeding. Baby-Friendly Hospital Initiative is important in areas of high prevalence. Some people are confused about the role of the BFHI in areas where there is a high prevalence of HIV infection in mothers. It is more important than ever in these areas. The special needs of HIV-positive women can be fully accommodated without compromising baby-friendly hospital status. The WHO, UNICEF, UNAIDS policy statement on HIV and infant feeding states that mothers have a right to information and support that will enable them to make fully informed decisions about infant feeding. In addition, it is important to continue to support breastfeeding for women who are HIV negative or of unknown HIV status. These are the 10 steps to successful breastfeeding. Every facility providing maternity services and care for newborn infants should: Number 1. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. Number 2. Train all healthcare staff in skills necessary to implement this policy. Number 3. Inform all pregnant women about the benefits and management of breastfeeding. Number 4. Help mothers initiate breastfeeding within a half hour of birth. Number 5. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Number 6. Give newborn infants no food or drink other than breast milk unless medically indicated. Number 7. Practice rooming in. Allow mothers and infants to remain together 24 hours a day. Number 8. Encourage breastfeeding on demand. Number 9. Give no artificial teats or pacifiers, also called dummies or soothers, to breastfeeding infants. Number 10. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. The first of the 10 steps is to have a policy. Have a written policy that is routinely communicated to all healthcare staff. A policy needs to ensure consistent, effective care for mothers and babies, provide a standard of practices that can be measured, and support actions. A policy is not a treatment protocol or a standard of care. Policy means that all staff agree to follow the protocols and standards, and that staff are required to do so by those in authority. It is not a personal decision to follow policy or not to follow it. This is similar to other policies, like what information to record on a birth certificate. If a policy is not followed on a specific occasion, the reason for not following it needs to be recorded. A policy incorporates the 10 steps and the international code and expands on how the steps are implemented in the health facility. The second step is about training. The aim of this course is that every staff member will confidently support mothers with early and exclusive breastfeeding, and that this facility moves towards achieving baby-friendly designation. The policy should support all of the 10 steps, and training assists to implement these steps. This course aims to help you feel confident in your knowledge and skills to care for mothers and infants in everyday practice. So during this course, we will discuss the rest of the steps in detail. You will have an opportunity to learn and practice on how to use communication skills to talk with pregnant women, mothers, and co-workers. Implement the 10 steps to successful breastfeeding and abide by the International Code of Marketing of Breast Milk Substitute. Discuss with the pregnant women the importance of breastfeeding and outline practices that support the initiation of breastfeeding. Facilitate skin-to-skin contact and early initiation of breastfeeding. Assist a mother to learn the skills of positioning and attaching her baby, as well as the skill of hand expressions. Discuss with the mother how to find support for breastfeeding after she returns home. Outline what needs to be discussed with the mother who is not breastfeeding and know to whom to refer this mother for further assistance with feeding her baby. Identify practices that support and those that interfere with breastfeeding. Work with co-workers to highlight barriers to breastfeeding and seek ways to overcome these barriers. Participation in this course helps to increase the level of knowledge, skill, and confidence, and provide consistency of information and practice throughout the health facility. The global strategy is supported by national policies, laws, and programs to provide, protect, and support breastfeeding and protect the rights of working women to maternity protection. So, summary of Session 1, the global strategy of infant and young child feeding builds on existing programs to assist optimal nutrition and thus give children a healthy start in life. The Baby-Friendly Hospital Initiative involves 10 steps as well as protection from marketing of breast milk substitutes to help promote a supportive health facility. Support of exclusive breastfeeding and breastfeeding hospital initiative continue to be important everywhere, even in areas of high HIV prevalence. Participation in this course can help to ensure that you are confident in your skills in breastfeeding support and that best practice is consistent in the health facility. Thank you.